CNA Practice Exam. Question number 1. When getting ready to make a bed, the nurse aide should place the clean linens on A. A chair or table beside the bed. B. The roommate's bed. C. A clean surface in the bathroom. D. The floor beside the bed. The correct answer is A. Place the clean linens on a chair or table beside the bed and not on a contaminated surface. Question number 2. The only purpose for using a restraint is to A. Ensure the safety of the client or others. B. Make the nurse aide's job easier. C. Calm a client who is verbally abusive. D. Help the client be quiet. The correct answer is A. Restraints are used to help ensure the safety of the client and others. Question number 3. Articles contaminated with blood or body fluids should be disposed of in the A. Soiled linen basket. B. Biohazard container. C. Soiled utility room. D. Client's room trash container. The correct answer is B. Place items that are contaminated with blood or body fluids in a biohazard container. Question number 4. To avoid pulling the indwelling urethral catheter when turning a client, the catheter tubing should be secured to the client's A. Bed sheet. B. Upper thigh. C. Bed frame. D. Hip. The correct answer is B. Secure the catheter tubing to the upper thigh with tape or a securing device. Question number 5. When collecting a 24-hour urine sample for a client, the nurse aide should request that the client A. Take a bath or shower before starting the urine collection. B. Select food items that do not contain red meat. C. Drink 2 liters of water. D. Discard the first voided urine. The correct answer is D. The client is asked to void and discard the urine from the first voiding. In some instances, a preservative is added to the collection bottle, the collected urine is kept cold through refrigeration, or it is kept on ice. Question number 6. When ambulating the client, the nurse aide should A. Ask the nurse for help. B. Be sure the client is wearing non-skid footwear. C. Ask a family member for assistance. D. Walk in front of the client and show the client the way. The correct answer is B. To ensure patient safety, the client must have on non-skid footwear before walking. Question number 7. Which of the following is the best personal protective equipment item for the nurse aide to wear when handling infectious waste that could splash or spray? A. Shoe covers. B. A mask. C. Goggles. D. A face shield. The correct answer is D. A face shield protects the entire face from accidental splashes. Question number 8. Which of the following would be an appropriate response for the nurse aide to make if a client expresses anger during care? A. Why are you being so mean today? B. You should not say such mean things to people. C. I will come back when your bad mood is over. D. You seem upset. Would you like to talk about it? The correct answer is D. You seem upset. Would you like to talk about it? Question number 9. The nurse aide has raised the height of the client's bed to provide care to the client, but the nurse aide forgot to bring the supplies needed. What should the nurse aide do next? A. Instruct the client to lie still. B. Quickly go to get the supplies. C. Lower the bed, and place the call light within reach. D. Ask the roommate to watch the client while the nurse aide gets the supplies. The correct answer is C. Ensure patient safety by lowering the bed and placing the call light within reach. Question number 10. A client requests that the nurse aide call the client's spiritual advisor. The nurse aide should A. Ask the client why the client wants the nurse aide to call the client's spiritual advisor. B. Tell the client that this is not part of the nurse aide's job. C. Tell the client that the nurse aide will inform the nurse of the client's request. D. Call the spiritual advisor for the client. The correct answer is C. Tell the client that the nurse aide will inform the nurse of the client's request. Doing so gives the nurse an opportunity to assess the client's emotional state and coordinate a visit from the spiritual advisor if requested. Question number 11. A client wakes up during the night and asks for something to eat. The nurse aide should A. Check client's diet before offering nourishment. B. Tell the client nothing is available at night. C. Explain that breakfast is coming in 3 hours. D. Tell the client that eating is not allowed during the night. The correct answer is A. Check the client's diet before offering nourishment. Question number 12. The nurse aide is preparing to bathe the client. What should the nurse aide do first? A. Test the temperature of the water. B. Help the client undress. C. Tell the client what the nurse aide is going to do. D. Close the door and windows. The correct answer is C. Tell the client what the nurse aide is going to do and ask for the client's permission before starting the bath water. Question number 13. When making a bed that is occupied by a client, the nurse aide should A. Leave the bed in the lowest position at the completion of the skill. B. Only replace the top sheet. C. Leave the bottom sheet untucked. D. Place soiled linens on the floor. The correct answer is A. Leave the bed in the lowest position at the completion of the skill. Question number 14. Frequent turning and repositioning of the client helps prevent A. Cyanosis. B. Indigestion. C. Coronary disease. D. Pressure injuries. The correct answer is D. Repositioning helps prevent pressure injuries. Question number 15. When applying compression stockings to the client, it would be best to do so while the client is A. Lying down in bed. B. Dangling the legs from the edge of the bed. C. Standing at the side of the bed. D. Sitting in a wheelchair. The correct answer is A. Compression stockings improve blood flow and are best applied while the resident is lying down in bed. Question number 16. The nurse aide is in the employee dining room. A group of nurse aides are eating lunch together and begin discussing how rude a certain client was acting. The nurse aide should A. Join in the conversation. B. Suggest that this is not the place to discuss the client. C. Be quiet and not say anything to the other nurse aides. D. Return to the unit and tell the client what was said. The correct answer is B. Suggest that this is not the place to discuss the client. Question number 17. The client's signaling device should be placed A. On the bed. B. Within the client's reach. C. On the client's right side. D. Over the side rail. The correct answer is B. Place the signaling device within the client's reach or directly in the client's hand. Question number 18. When helping a client who is recovering from a stroke to walk, the nurse aide should assist A. On the client's strong side. B. On the client's weak side. C. From behind the client. D. With a wheelchair. The correct answer is B. The nurse aide should assist on the client's weak side. Question number 19. A client who is confused begins to cry and scream out for his parent. What should the nurse aide do next? A. Place the client in a geriatric chair. B. Restrain the client in his bed. C. Talk to the client in a calm voice about familiar things. D. Leave the client alone in his room until he calms down. The correct answer is C. Talk to the client in a calm voice about familiar things. Question number 20. Which of the following actions would be best for the nurse aide to take to show respect to the spiritual needs of a client? A. Escorting the client to religious services. B. Discussing the nurse aide's religion with the client. C. Assisting the client to read the client's religious materials. D. Requesting that the facility's spiritual advisor visits the client. The correct answer is C. Assisting the client to read the client's religious materials. Question number 21. While the nurse aide is providing care to the client calls the nurse aide by the name of the client's child, who died several years ago. The nurse aide's best response would be to A. Quickly finish providing care and leave the client alone. B. Pretend to be the client's child. C. Ignore the client because the client is confused. D. Ask the client about the client's favorite memories of the client's child. The correct answer is D. Ask the client about the client's favorite memories of the client's child. Question number 22. When providing care for a client receiving oxygen therapy, the nurse aide should A. Check the ears for pressure points. B. Tape cracks in oxygen tubing. C. Let the nurse know that the nurse aide cannot care for the client. D. Change the flow rate if the client is short of breath. The correct answer is A. Check the client's ears for pressure points. Question number 23. A client falls and suffers a deep cut on the forehead. What should the nurse aide do next? A. Take the client to the hospital. B. Help the client back to the bed. C. Take the client into the bathroom to wash out the cut. D. Stay with the client and call for help. The correct answer is D. Stay with the client and call for help. Question number 24. The client has been sad and depressed since being admitted to the facility yesterday. What would be the best thing for the nurse aide to do for the client? A. Arrange for the client's spiritual advisor to visit the client. B. Turn on the television in the client's room and leave the client alone. C. Force the client to take part in facility activities. D. Introduce the client to other clients and staff members. The correct answer is D. Introduce the client to the other clients and staff members. Florida Training Academy is owned and operated by a registered nurse. For exam prep courses and healthcare training, visit www.fltraining.com. Thank you for watching and subscribing to our channel.